I am Dr. Parth Goyal, consultant psychiatrist, Parth Hospital, Ahmedabad. Now, let me talk to you about a scenario which most of you can relate to. I see a patient in my OPD who is suffering from clinical depression for a period of 3 to 5 years. The severity of the depression has been going up since the past few years. The patient has tried multiple medications from multiple psychiatrists. However, there is a minimal response to the depressive state. In the current prescription, the patient is on a combination of 3 to 4 antidepressants with 1 or 2 additional tablets which are meant to help augment the effects of these antidepressants. Although the patient is on such a complex regimen, the subjective reporting in terms of improvement of depressive symptoms is very minimal. Basically, the patient is not experiencing a relief from his depressive symptoms despite being on a lot of medications. In such cases, the patient was advised ECT, and the patient wanted to understand more about why ECT would work when so many medications have already failed. When they came to me, they were feeling very sad and they were almost hopeless because a plethora of medications had not worked. Along with the stigma of ECT, they were increasingly concerned whether ECT would actually help them or would end up worsening their underlying situation. So let us try to understand this example in a better way. When a patient suffers from clinical depression, the first line of treatment is to give them oral antidepressants. Oral antidepressants are tablets which are consumed on a daily basis, once or maybe twice a day. They enter the bloodstream and then cross into the brain, and there they increase the levels of certain chemicals in the brain. These chemicals are known as neurotransmitters. The most commonly implicated neurotransmitters or chemicals in depression are serotonin, dopamine, and norepinephrine. Serotonin is a happy hormone. It allows for patients to be in a good mood. Dopamine is a reward hormone where patients are able to experience happiness upon achievement or upon completion of a task. And norepinephrine is the hormone which basically regulates energy levels, activity levels, arousal levels, and their ability to go about on a day-to-day basis. In severe depression, there is a reduction of all these brain chemicals globally. And antidepressant medicines are meant to increase the production of these neurotransmitters. Now, in most cases, antidepressants work very well, but in certain cases, there is a resistance to the effects of antidepressant medication. That means the patient, even when consuming oral antidepressant tablets, does not seem to respond in terms of the illness. There is no significant reduction of sadness. The patient is not able to experience pleasure. The patient does not derive any joy from the surroundings or from activities that they used to do and enjoy earlier. There is lethargy. There is no motivation to do any action. In severe cases, there can be suicidality, which could either be in the form of a thought where they want to end their life, or in the form of an action where they go ahead and actually take a step towards ending their life. In such cases, when medications don't work, ECT becomes the gold standard of treatment. ECT is a treatment which works not only by reducing the severity of the depressive illness, but also by bringing about this reduction in a very short span of time. In most patients with severe psychiatric illness, time is of the essence. So, naturally the question will be, if medicines have not worked, why would ECT work any differently? Now, there is a lot of neuroscience behind this. Let me simplify the main points for you. ECT is an external treatment whereby a controlled electrical stimulus is applied to the brain, inducing a therapeutic seizure. This seizure, when induced, leads to changes in the brain activity. There are multiple mechanisms by which it works. The most important and the most common ones include by directly stimulating the neurons to produce more serotonin, dopamine, or norepinephrine. As you might recall from the earlier part of the video, these are the chemicals or the neurotransmitters in the brain required for normal day-to-day functioning, for experiencing happiness and pleasure. When neurons are directly stimulated to produce and release more neurotransmitters, there is a significant reduction in the severity of depressive symptoms. The second way by which ECT works is by inducing neuronal growth. That means when ECT is given to a patient, the number of brain cells in the brain increase, as a result of which there are more number of cells producing more number of happy hormones, therefore leading to a reduction in illness. ECT also helps by restoring communication between various brain regions. So the brain is a complex organ with multiple areas in it. In depression, these areas do not adequately communicate with each other. When ECT is given, it clears up the pathways of these communications, and different areas of the brain are better able to speak to each other. And last but not the least, the most recent research in depression links it to be a neuroinflammatory illness. What that means is, just like gut issues, just like arthritis, just like a lot of other chronic illnesses, even depression is seen as an illness which arises because of increased inflammation in the brain. Therefore, a lot of patients actually do respond to medicines which reduce inflammation. When ECT is given, there is a rapid inflow of natural hormones or chemicals in the body which serve to reduce inflammation. In short, when you're treating a patient of depression with ECT, you're essentially flooding their brain with chemicals which can reduce the inflammation that happens in the brain and can lead to significant reduction in depressive symptoms and, more importantly, improvements in quality of life. So, to answer your question in brief, why will ECT work when medicines don't? Because ECT works in multiple different ways as compared to medicines which have only one mechanism of action. ECT has multiple targets in the brain as compared to medicines which have singular targets. ECT can also induce a systemic, as in a whole body reaction, which can support in the treatment of depression, which medicines can't. And hence, for all these reasons, ECT is considered to be the gold standard of treatment in a variety of psychiatric illnesses. I hope this video has been incredibly helpful to you. Please feel free to read up on it and to ask your psychiatrist about any questions that you might have regarding ECT. Thank you.